skin back here.
Like that.
What else did I miss? I can't hear. You guys might have the same question.
When we do the inspection on the arms, some of them are in different systems. So we do it once, you'll know that and mark it, go to other system and mark it.
Is it in separate systems?
There's some that inspect the upper extremities, some that inspect the twice or something that actually say that.
It says in peripheral vascular and in
Musculoskeletal as well.
okay.
Yeah. So if we do it once, you'll be fine and go check it out the other one.
And all that, you didn't do any of that.
Well, it's not on there. It's not on the rubric. I'm just not on the rubric.
I don't think you did. You percuss the
You mean the
liver?
blunt percussion? Yeah, I did that.
Well, you didn't do the liver.
You're right. I didn't do the liver. So how many points off?
One.
All right, I'm at an 83.
80. What'd you miss?
I'm really scared.
83 out of 85.
Oh, I'm like, where did you miss 13 points? You know, in my master's health assessment class, we had to do a lot more, and I forgot rapid alternating movements. Did y'all have to do that in neuro? This is rapid alternating movements.
No,
And this is rapid alternating movements.
That's in the video.
Is it? And I forgot to do that. It was worth 5 points. I was so mad. I'm like, what? You would think something like as big of a deal as like heart sounds or lung sounds would be worth a lot more. Rapid alternating movements. I was like, 95
I've been handling it for 95 or 90.
Ron Burkowski did that in the beginning, right?
Yeah.
I do mine based on positions. I do all standing.
I
all
know,
sitting.
now that I see that, now I don't have time to write a whole order like that. It's a good way to look at it.
Sit down. What else did I miss? We have a question over here. Sorry about that.
If you have a reason why you can't do it,
I can't hear, guys. I'm sorry. Maybe it's just on clock.
if you have a reason, if you have a health reason why you can't do it resistant, is there anything wrong with that? Because there are some things you did.
Right,
I'm
I
going
need
to talk
to.
with you later. Because there are
Right, I
some
would
things
just
you
need to know that
Okay.
ahead of time. And so if it's just one leg, making sure, and just like in the book discusses with any system, when there's pain involved, you skip that area. Right? When you're palpating the abdomen, you don't, and somebody's complaining of right upper quad pain, you don't palpate the right upper quad. You just skip any area that there's complaints of pain.
If, let's just say, for example, in your subjective data, the client didn't reveal to you they had asthma, and then you heard, would you kind of do a cold spa then, or you just
Not necessarily, because
Okay.
cold spa is obviously gathering data based, subjective data.
Okay.
So it would just end up in your objective data.
Okay. All right.
But what if they come in complaining of dizziness or fatigue, and it could not necessarily be a musculoskeletal issue. It's probably lack of oxygenation, right? And so your assessment, based on the fact that they're complaining of fatigue, or excessive tiredness, or any of those things, or lightheadedness, could be lack of oxygenation, and you found wheezing, then your nursing diagnosis would probably be, ineffective, what is it called? Oxygenation related to, narrowing.
So if you find something in your assessment that had not been
Right, you would report that to the physician and say, patient's wheezing and, bilateral,
so you don't ask them
lower
any more
loads.
questions
You
at
don't
that time.
You can say, you know what, I hear some wheezing. Have you been having any difficulty breathing?
Okay.
And they might say, no, not at all. Just real tired.
Yeah.
Sats are 91.
Yeah.
I bet you are tired. I bet you can't climb those stairs. Yeah. So
Okay.
that would be something that you would definitely want to report to the physician to get some bronchodilators for your patient.
When you're also taking for the roots in the abdomen, you are going to listen with the femoral arteries, correct?
Correct.
So you are going to do that.
Well, it's not on
But
the
it's not on the. If it's not.
It's not on the chart, but when you look it up in the book, it tells you to do it over the femoral, the femoral.
Right. I mean, you're welcome to do that, but just know that you don't have to because it's not on the rubric. I mean, it's something that will probably become part of your routine doing comprehensives in the hospital or doctor's office or wherever you're doing clinicals.
Okay.
It's something that you'll probably end up doing because you see everybody else doing it, but you're not going to be grading on it this semester.
Okay.
Your lymph node, you just pretty much palpate it all over the neck?
Right.
And what about these?
I didn't get those.
It's on the list.
Is it?
Yeah.
All right. See, remember how I said that there's I get partial points?
Yeah.
So in other words, how much is that one worth?
Wait, it's on the list.
So if you miss one,
It's already pre-post, but like it keeps tracking.
Did it? Did it? Those are the ones I missed. So out of
Which ones did you miss?
1, 2, 3, 4, 5, 6, 7, 8. I'll take off a point.
How many
You
would
missed
you take
one
off?
set.
Which
Yeah.
ones did you miss? How many points would you take off?
Just this one here. She did like all the.
Pre-oracle post all the way up to supplemental.
She forgot that one.
I usually do those when I'm there at that area doing reflexes.
From a clinical perspective, missing those would not be, I'm not saying good, but I mean, if you didn't see any wounds, no history of breast cancer, no infection, you're not missing a hyper vital.
Well, I mean, I don't know.
I
It
mean-
depends on, again, if the patient comes in with fatigue and they end up having, you know, a left breast size 4 centimeter breast cancerous tumor and they don't know it, and you don't do lymph nodes here, and you skip the breast exam.
Okay. Right.
Would
You
you
know what I mean?
normally
Yeah,
do that exam like in a general health assessment?
Yes. All lymph nodes need to be assessed, even inguinal in a general health assessment. A lot of times, that's, at least in the health clinics, young girls are diagnosed with STDs on nothing more than swollen inguinal lymph nodes. And then, yeah, the nurses know that if they have swollen inguinal lymph nodes, that they need to do a pelvic exam and some testing. And then lots of education. I've had senior nursing students, they're doing their practicum at Piedmont Noonan in the ER, and they can tell you some horror stories about how uneducated the population is around here, young girls are about unprotected sex. Horror stories. Their normal is not my normal, or, you know, it's very sad. Other questions? I want to give you guys as much time to practice today. Please let me know what you need. And what did I make? 82.8, and then if my documentation is impeccable, I made a 97.8.
I'm a little worried that like the sheets that you give us are so long that it's going to take me more than an hour to write all that documentation.
And that's okay. I'm not putting time limits on documentation because that's realistic. In the clinical setting, you might have your entire 12-hour shift to get your documentation in. And realistically, guys, the most important thing is that you get in there and you assess your patient, whether it's a comprehensive or focused exam. Is my exam going to be all of that if somebody walks in and they're going, no, obviously not. That's not going to be my exam. But doing a head-to-toe at the bedside is going to be much quicker, much more fluid. And if you have 5 patients, you got to go boom, 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 boom. You're not doing one, sitting down and documenting, going and doing the other, sitting down and documenting. Because by the time you get that 5th patient, it's 12 o'clock and they've gone an entire, what, you got there at 7, 5 or 6 hours without even laying eyes on their nurse. So you're going to be doing all of your assessments, probably giving all of your medications, and you're going to need to remember 5 assessments. You will be writing during your assessment. Unless you're in a hospital that has a cow. Does anybody know what a cow is? Computer on wheels. That's what it stands for. So they're called a cow. And that's when you just take it into each room and you turn around and you click, 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 click. Next.
That's a
If
time
your patient's
saver.
on isolation, you can't
Are
take a
those
cow.
fairly
in there.
common or not?
What, the cows? Yeah. Piedmont Noonan has them. Fayette has them. Yeah.
Good.
See? Does Tanner have them? I don't know. Who's been to Tanner? Anybody know Tanner? Tanner girl.
I know my mom works in a lot of the area hospitals. They aren't allowed to call them cows because the patient overheard her nurse talking about the cow in the room.
Oh, man.
And so they're having to be really careful about calling them cows.
That's ridiculous.
Yeah,
It's none of
the
their
patient
business
thought they
what
were
they call
talking
it.
about her.
That cow.
I can see that.